5 minutes of fame. What to do, what to tell, what to share, scary. But then the solution is simple. Put the problem at the table, look for questions and later for solutions. We call it problem-based learning. The ancient Greek did it already, but they didn't have internet or voting pads or multiple choice questions. So we do it in Asia, we do it in Africa, and now we do it here, and we call it innovative. And innovative is what we use for our e-learning programs to teach healthcare workers and speak with them, listen to them, learn from them, we learn from them, they learn from us, and we hope we do that the same with you. You all have a voting pad. I don't think we have to explain here what a voting pad is and how to use it. Everybody has one? So in the 5 minutes we have to do the questions. And I put on my teaching dress, so I'm like a real teacher, like I'm in Africa also. And I brought Anne-Marie, who's a wizard with the computer. We saw technique failed sometimes, and we laughed together because in Africa and Asia it doesn't fail so often as it did here this afternoon. But I should keep my fingers crossed for the turning point now. First question. So this is something some people know because most of you are in the developing organizations. I didn't see so many entrepreneurs yet, but how many people depend on one doctor in developing countries? And that's especially Sub-Saharan Africa and Asia. The parts of Asia and India, Indonesia, Pakistan, Afghanistan. One doctor per 350,000, one doctor per 35,000, one doctor per 3,500, or one doctor for 350 people. How many people voted? 26, 28? 37? A little bit more people here than 37, I hope. Okay, let's go. What are the answers? Not so bad, but the 20% in many parts of Sub-Saharan Africa, the people who vote for one are right. In Mozambique, it's only 3 doctors per million people. So that's amazing, isn't it? And the people of 16, that's really the emerging economies, countries like Ukraine, they have these. And we have even more than this, 250. Not if you look at general practitioners, that's 2,000, but with all the specialists you get to 250. Shall we go for the next question? So how can we help these healthcare workers, not only doctors, but also nurses and counselors, the most efficient way? By financial support, sending medical equipment, building hospitals, sending volunteers, knowledge transfer, up-to-date training. What do you think is the best answer? Now it's your vote. Okay, we have 47 people in the room, 48. Yes? Wow! That's exactly what we do. Okay, next question. How much time left?
1 minute.
Okay, we make it. What do you think is the best way of knowledge transfer? You've all said knowledge is most important. We can do that different ways. We can invite professionals to the Netherlands and they have a training with us. We can also send professionals there, for instance, surgeons who do special eye operations or specific intensive care nurses. You can do distance learning via books and computer. And you can also do blended learning. That's a combination of online and offline learning. Yes. 42, we have to go for the time. The time is almost up. This is exactly, you guessed what we are doing. We do blended learning, online and offline learning for doctors, nurses and counselors, HIV, pediatric HIV, TB, mental health, cardiovascular diseases, the second burden in South Africa, but also for the community, for youngsters about prevention, sexual transmitted diseases, sexuality, like Melinda Gates told about contraception. The next one. But we want to grow. We want to do more. We want to do more trainers. What's the best way to scale up? Last question, because the time is up.
Give the microphone. Quick, vote, because other speakers have to vote. Yes.
Wow. So people who can help us with this, come to our table, please, and help us to grow. Thank you very much.